Picture this: you wake up feeling unusually tired. It's not the typical drowsiness after a late night, this feels different. Days turn into weeks, and that exhaustion doesn't fade. You think it might be stress or maybe you're not sleeping well enough, but the reality could be much more serious. Kidney disease is a silent threat, affecting nearly 37 million people in the United States alone, and shockingly, most don't even know they have it. Why? Because the signs are subtle, often masked as everyday issues that don't seem alarming until it's too late. Today, we're going to dive deep into these silent symptoms, the ones that hide behind common fatigue, swelling, or changes in your daily routine. By the end of this video, you'll know what to look out for and understand how catching these signs early could save your kidneys, and ultimately, your life. Recognizing these small changes in your body can be the key to getting ahead of kidney disease before it causes irreversible damage. What are kidneys and why are they important? Before we dive into the symptoms, it's important to understand just how critical your kidneys are. These two small, bean-shaped organs sit quietly below your rib cage on either side of your spine, working around the clock without you even realizing it. They're like your body's filtration system, constantly sifting through your blood to remove toxins, excess salts, and waste. But they do so much more than just make urine. Kidneys help balance electrolytes, ensuring your body's fluid levels are stable, and they also regulate your blood pressure. They even play a role in stimulating the production of red blood cells, keeping oxygen flowing through your body. Now, imagine what happens when these hard-working organs start to fail. Toxins begin to build up in your bloodstream, throwing everything off balance. You might not notice it right away, but your body will start to signal you, sometimes in subtle ways, that something's not right. That's why it's so crucial to recognize these early signs before the damage becomes irreversible. Your kidneys are small but mighty, and protecting them is key to maintaining your overall health and well-being. The silent killer: early signs of kidney disease. Now let's dive into the symptoms you need to watch for. These signs often appear slowly, creeping up on you over time, making them easy to overlook. Many of them can be mistaken for everyday problems or signs of aging, but ignoring them could allow kidney disease to worsen. Let's break these symptoms down, one by one. Symptom 1: fatigue and weakness. One of the earliest and most common symptoms of kidney disease is persistent fatigue and weakness. This isn't just the tiredness you might feel after a long day or a night of poor sleep. It's the kind of exhaustion that creeps up on you and sticks around, no matter how much rest you get. So, what's happening here? When your kidneys aren't working properly, toxins and waste products, which are normally filtered out through urine, begin to build up in your bloodstream. This buildup makes it harder for your body to function efficiently, leaving you feeling worn out and sluggish. But that's not all. Kidney disease can also lead to anemia. Anemia occurs when your kidneys stop producing enough of a hormone called erythropoietin (EPO), which stimulates the production of red blood cells. Without enough red blood cells, your body struggles to carry sufficient oxygen to your muscles and organs. The result? Chronic fatigue that doesn't go away with sleep. It's a vicious cycle. Your body lacks oxygen, your muscles feel weaker, and everyday tasks that were once easy, like walking upstairs or even just getting out of bed, start to feel overwhelming. If you're someone who leads a busy life, you might be tempted to chalk up this constant tiredness to stress, lack of sleep, or aging. But if the exhaustion persists and there's no obvious explanation, it's worth considering whether your kidneys could be the source of the problem. Ignoring this sign could mean allowing kidney disease to progress unnoticed. Moreover, this type of fatigue isn't just physical, it can also affect your mental state. You might find it harder to stay focused or motivated, leading to irritability or frustration. Fatigue from kidney disease doesn't just sap your energy, it can drain your enthusiasm for daily life. So, if you find yourself tired for no apparent reason, even after a full night's rest, it's a good idea to take notice. Fatigue might be your body's way of telling you that something isn't right under the surface, and addressing it early could prevent further kidney damage. Symptom 2: trouble concentrating. Brain fog, a term often used to describe the feeling of being mentally cloudy or unfocused, is another symptom that kidney disease can cause. When your kidneys are struggling to remove toxins from your bloodstream, these toxins can start to affect your brain as well. You may find yourself forgetting simple things, like where you put your keys or what you were about to do next. More frustratingly, tasks that once seemed straightforward, reading, following a conversation, or even solving basic problems, may suddenly feel challenging. Why does this happen? Well, think of your brain like an engine. For it to run smoothly, it needs clean, filtered fuel. When the kidneys aren't filtering out waste and toxins properly, the fuel becomes contaminated, leading to slower mental processing. Toxins, such as urea, which is typically removed by the kidneys, can build up and interfere with your cognitive function. This accumulation can cause confusion, difficulty concentrating, and memory problems. For those affected, this symptom can be incredibly frustrating. It's easy to blame stress, overwork, or aging for these mental lapses. In fact, many people ignore this sign, thinking it's just a normal part of getting older. But persistent trouble focusing or frequent memory lapses could be a red flag for kidney disease, especially when paired with other symptoms. It's important to note that this mental fog isn't just limited to forgetfulness. You may also feel a lack of clarity in your thinking or find it difficult to make decisions. You might start a task and suddenly feel overwhelmed, even if it's something you've done countless times before. If this type of brain fog becomes a constant presence in your life, it's time to think about whether there's an underlying health issue, like kidney disease, that could be causing it. Don't dismiss it as normal. Your brain might be telling you that your kidneys need attention. Symptom 3, swollen feet or ankles. Ever look down at your feet or ankles and notice they seem unusually swollen or puffy? Swelling in these areas might not seem like a major health concern at first, especially if you've been on your feet all day or traveled recently. But when swelling becomes a persistent issue, especially if it's accompanied by other symptoms, it could be a sign that your kidneys aren't functioning properly. Your kidneys play a crucial role in maintaining the balance of fluids in your body. When they're not working effectively, they can't remove excess sodium and water as they should. This extra fluid tends to accumulate in your lower extremities, leading to noticeable swelling, a condition known as edema. Swollen feet or ankles might start off as mild puffiness that you could easily brush off as a minor inconvenience. But over time, this swelling can become more pronounced, and in some cases, even painful. It might feel like your shoes are tighter than usual or that walking long distances causes discomfort. What makes this symptom particularly concerning is that it often goes unnoticed or misattributed to other causes like weight gain, standing for long periods, or even poor circulation. But swelling in the lower legs or ankles can also indicate that your kidneys are struggling to filter fluids effectively. If the swelling worsens or doesn't go away after resting, it's worth consulting a doctor, as it could be a sign that your kidneys are under stress. Additionally, edema can spread beyond your feet and ankles to other parts of your body, such as your hands, face, or abdomen, indicating worsening kidney function. If you press on the swollen area and it leaves an indentation, it's a sign that the swelling is fluid-based. In the context of kidney disease, addressing this issue early on is key. Untreated, it can lead to further complications, including high blood pressure and heart problems, as the extra fluid puts strain on your cardiovascular system. So, if you're noticing persistent swelling, don't ignore it, your kidneys could be in trouble. Symptom 4, shortness of breath. Have you ever found yourself struggling to catch your breath after climbing a short flight of stairs or doing something that normally wouldn't make you winded? Shortness of breath, particularly when it's out of proportion to your level of activity, could be another silent sign of kidney disease. This symptom can occur for a couple of reasons, both related to the kidney's role in maintaining balance in your body. First, when your kidneys aren't functioning properly, they can't remove excess fluid as effectively, leading to fluid retention. This excess fluid can sometimes accumulate in your lungs, a condition known as pulmonary edema. When your lungs are filled with fluid, it becomes much harder for oxygen to pass through them and into your bloodstream, making breathing more difficult. Even minimal exertion can leave you feeling like you're gasping for air. The second reason has to do with anemia, which we mentioned earlier. Since your kidneys play a key role in red blood cell production, kidney disease can lead to a shortage of red blood cells, which in turn means there's less oxygen circulating in your body. With less oxygen, your muscles and organs, including your lungs, don't get the oxygen they need to function properly, making it harder to breathe. This symptom can be especially dangerous because many people attribute shortness of breath to aging, being out of shape, or even anxiety. However, if you're finding it hard to breathe, especially if you're also experiencing fatigue or swelling, it's time to take this seriously. Difficulty breathing could be a sign that your kidneys are struggling, and addressing it early could prevent further complications. Symptom 5: Changes in urination. Since your kidney's primary job is to produce urine, any noticeable changes in your urination patterns are often one of the earliest and most direct signs that something might be wrong with your kidneys. Whether it's the frequency, color, or even the consistency of your urine, changes in these areas can indicate that your kidneys are no longer filtering your blood as efficiently as they should. For example, if you're suddenly waking up multiple times during the night to urinate, this could be a sign that your kidneys are struggling. Frequent nighttime urination, known as nocturia, is often overlooked because people tend to attribute it to simply drinking more fluids before bed or getting older. But if it's happening regularly and disturbing your sleep, it could be a sign of kidney trouble. On the other hand, some people experience the opposite issue. They notice they're urinating much less frequently than usual. This could be because the kidneys are no longer filtering out fluids effectively, leading to fluid retention in other parts of the body, such as your legs or abdomen. If you're not producing as much urine as you typically do, or if the urge to go seems far less frequent, it's worth paying attention to. Changes in the appearance of your urine can also be a telltale sign of kidney problems. Healthy urine is typically a pale yellow color, but if you notice that your urine has become much darker, or it appears foamy or bubbly, this could indicate excess protein in the urine, another symptom of kidney damage. Foamy urine occurs when there's protein leaking into your urine, which your kidneys are supposed to filter out. The presence of blood in your urine, a condition known as hematuria, is another serious sign. Blood in the urine can cause it to look pink, red, or brown, and while this could be caused by something less serious, such as a urinary tract infection, UTI, it's also a possible indicator of kidney disease. The blood vessels in your kidneys could be damaged, allowing blood to leak into the urine. It's easy to dismiss these changes, especially if they happen gradually, but don't take them lightly. Your urine provides a direct insight into how well your kidneys are functioning, and any unusual changes should prompt you to see a doctor. Addressing kidney disease in its early stages is critical to slowing its progression, and keeping an eye on your urination patterns can offer vital clues. Symptom 6: Dry, itchy skin. When we think of kidney disease, skin problems might not be the first symptom that comes to mind, but they can be an important signal that something is wrong. One of the lesser-known signs of kidney dysfunction is persistently dry, itchy skin. Your kidneys play a crucial role in balancing the minerals and nutrients in your blood. When they aren't working properly, it can throw off this balance, leading to a buildup of waste products in your bloodstream. This can result in dry, flaky, or itchy skin, a condition that may not go away with simple lotions or moisturizers. As your kidneys struggle to maintain the right balance of minerals like calcium and phosphorus, your skin can suffer. In particular, phosphorus buildup in the blood, known as hyperphosphatemia, can lead to intense itching. This isn't just the occasional itch that can be resolved with scratching. This itching can become severe and constant, interfering with your daily life and making it hard to focus or sleep. Over time, you might notice that no amount of hydrating creams or skincare routines seem to make a difference, because the root cause of the problem lies deeper within your body. Many people ignore persistent itchy skin, assuming it's due to dryness or allergies, but when it's accompanied by other symptoms like changes in urination or swelling, it could be pointing to kidney issues. In some cases, the itching may even result in red, raw skin from excessive scratching, which can open up the risk for infections. If you find yourself constantly itching without relief, it's a good idea to explore whether your kidneys are the culprit. Addressing the underlying kidney problem can help relieve the skin symptoms, but catching it early is key. Symptom 7: Metallic taste in the mouth. Have you ever noticed a strange, metallic taste in your mouth, or found that food just doesn't taste the same as it used to? This symptom, known as dysgeusia, is a common but often overlooked sign of kidney disease. When your kidneys aren't filtering waste properly, toxins begin to build up in your bloodstream, affecting your sense of taste and smell. Many people with kidney disease report that food starts to have a metallic or bitter taste, and in some cases, they develop chronic bad breath, known as halitosis. This change in taste isn't just an inconvenience, it can have a significant impact on your appetite and overall nutrition. For some, the metallic taste becomes so pervasive that they lose interest in food altogether, which can lead to weight loss and malnutrition over time. In advanced stages of kidney disease, this loss of appetite can become severe, contributing to further health complications. The buildup of urea in the blood, a condition known as uremia, is particularly responsible for this metallic taste, and it's a sign that your kidneys are struggling to keep up with their filtering duties. If you've noticed that your sense of taste has changed and food doesn't seem as appealing as it once did, or if you're dealing with persistent bad breath, it's worth considering your kidney health. While these symptoms may seem mild compared to others, they can significantly affect your quality of life. The sooner you address them, the better your chances of managing the underlying kidney issues before they progress to a more advanced stage. Symptom 8: High blood pressure. Your kidneys and your heart are closely connected, and when one starts to struggle, it can put strain on the other. High blood pressure, or hypertension, is both a cause and a consequence of kidney disease. When your kidneys aren't functioning properly, they have a harder time regulating your blood pressure, which can lead to dangerously high levels. In turn, high blood pressure can cause further damage to the small blood vessels in your kidneys, making the disease worse. It's a vicious cycle that can be difficult to break without early intervention. Normally, your kidneys help control blood pressure by regulating the amount of sodium and water in your body, as well as by producing a hormone called renin, which helps manage blood vessel constriction. When the kidneys are damaged, they may start to release too much renin, leading to increased blood pressure. At the same time, the kidney's inability to filter out excess sodium and fluid can cause fluid retention, which further raises blood pressure. The combination of these factors puts your heart and kidneys at risk, and over time, can lead to more serious cardiovascular problems. What makes high blood pressure so dangerous is that it often doesn't cause noticeable symptoms until it has done significant damage. This is why it's sometimes referred to as the silent killer. If you've been diagnosed with high blood pressure or if it runs in your family, it's especially important to monitor your kidney health. Regular checkups, maintaining a healthy diet, and managing your blood pressure with medication if necessary can help prevent kidney disease from progressing. Don't wait for other symptoms to appear. High blood pressure alone can be an early warning sign that your kidneys are in trouble. Symptom 9: Persistent nausea and vomiting. Nausea and vomiting are unpleasant symptoms that most people associate with stomach bugs or food poisoning, but they can also be key indicators of more serious underlying health issues like kidney disease. As your kidneys begin to fail, toxins that would normally be filtered out start to accumulate in your bloodstream, leading to a condition known as uremia. When the levels of these waste products rise, your body reacts by trying to get rid of them in other ways, often triggering persistent nausea and vomiting as your system becomes overwhelmed. This isn't the kind of occasional nausea that passes after a few hours or a day. It's a constant feeling of unease in your stomach that can occur even when you haven't eaten anything. Many people with chronic kidney disease, CKD, report a near constant sense of nausea that disrupts their daily lives, leaving them unable to enjoy food or, in more severe cases, unable to keep anything down. This persistent nausea can be incredibly debilitating, leading to a reduced appetite and, over time, significant weight loss and malnutrition. As kidney disease progresses, the vomiting may become more frequent and harder to control, further exacerbating the nutritional deficiencies that already accompany the condition. Additionally, the buildup of toxins in the blood can also upset your stomach lining, contributing to frequent episodes of vomiting. If you find that you're nauseous more often than usual, or if vomiting has become a regular occurrence without any obvious cause, it could be a signal that your kidneys aren't functioning as they should. Many people overlook these symptoms, assuming they're just dealing with a stomach bug, stress, or some other common illness, but if the nausea and vomiting persist for days or weeks without improvement, it's time to consider the possibility of kidney disease. What makes this symptom even more concerning is that persistent vomiting and nausea can create a dangerous cycle of dehydration, which places additional stress on already compromised kidneys. The combination of reduced fluid intake, due to nausea, and the loss of fluids through vomiting can worsen kidney function, speeding up the progression of the disease. If you're experiencing unexplained nausea, especially when it's paired with other kidney-related symptoms like changes in urination or swelling, it's crucial to seek medical attention promptly. Symptom 10: Persistent back pain. Pain in your lower back or sides is often dismissed as a muscle strain or something related to your posture, but when it's persistent and doesn't seem to have a clear cause, it could be pointing to kidney issues. Kidney pain is usually felt in the lower back, just below the rib cage, on either side of your spine, and it can range from a dull, nagging ache to sharp, severe pain. This pain can sometimes be confused with back pain caused by muscle or spine issues, but there are subtle differences that can help you distinguish between the two. Kidney pain often comes in waves and might feel like a deep, constant discomfort that doesn't get better with rest or changing positions. Unlike muscle pain, which might feel worse when you move or lift something heavy, kidney pain can remain constant regardless of your activity level. This pain may also radiate down towards your abdomen or groin, especially if it's related to kidney stones or an infection. The location and intensity of the pain can vary depending on what's causing the issue, but persistent pain in this area should never be ignored, as it could be a sign of a more serious underlying condition, such as kidney infection, polycystic kidney disease, or advanced kidney failure. Kidney infections, pyelonephritis, are one of the common causes of back pain related to kidney function. These infections typically start in the urinary tract and can travel up to the kidneys if left untreated. In addition to back pain, kidney infections can cause symptoms like fever, chills, frequent urination, and a burning sensation when you urinate. Polycystic kidney disease, PKD, is another condition that can lead to chronic pain in the kidney region. In PKD, clusters of cysts develop in the kidneys, which can cause discomfort or pain as they grow and press against nearby organs. For individuals with chronic kidney disease, CKD, back pain can be a symptom of the kidney's inability to filter out toxins, leading to inflammation or even kidney scarring. As the disease progresses, this pain may become more persistent, signaling that kidney function is declining. While kidney pain is less common in the early stages of CKD, it can be a significant symptom as the disease advances. In some cases, people with CKD experience referred pain from the kidneys, which might be felt in the lower back or even the sides of the abdomen, making it harder to pinpoint the exact cause. Another possible cause of kidney-related back pain is kidney stones. When minerals in your urine crystallize and form hard stones, they can block the flow of urine and cause intense pain. Kidney stone pain often comes on suddenly and is described as one of the most severe types of pain a person can experience. It may start in your lower back or side and radiate towards your groin, and it can be accompanied by nausea, vomiting, or blood in your urine. While back pain isn't always linked to kidney problems, it's important to take note if the pain is persistent and doesn't seem to be related to any specific injury or activity. If it's accompanied by other kidney-related symptoms like changes in urination, fatigue, or swelling, it's worth getting checked by a healthcare professional. Persistent pain in this area should never be ignored, as catching kidney disease early can prevent further damage and improve your long-term prognosis. Risk factors for kidney disease. Let's talk about who is at risk. Kidney disease doesn't happen out of nowhere. There are a number of risk factors that can increase your chances. One of the biggest is diabetes. High blood sugar can damage the blood vessels in the kidneys, leading to disease over time. High blood pressure is another major risk factor, as it puts extra strain on your kidneys. A family history of kidney disease can also increase your risk, as well as lifestyle factors like smoking, obesity, and poor diet. The more of these risk factors you have, the higher your chances of developing kidney problems, so it's important to manage them where possible. The importance of early detection. Why is catching kidney disease early so critical? The earlier you catch it, the more options you have for slowing down its progression and minimizing damage. Untreated kidney disease can lead to end-stage renal failure, which often requires dialysis or a kidney transplant. But if you catch it in its early stages, there are treatments available to protect your kidneys and improve your quality of life. Early detection is truly a game changer, which is why recognizing these silent signs is so important. What to do if you suspect kidney problems? If any of these symptoms sound familiar, don't ignore them. The first step is to see your doctor and get a full checkup. Your doctor may refer you to a nephrologist, a kidney specialist, who can run tests to assess your kidney function and help you understand what's going on. Simple blood and urine tests can reveal a lot about the health of your kidneys, and catching problems early can help you avoid more serious issues down the line. Conclusion. Let's recap the key points. Kidney disease often flies under the radar because its symptoms can be so subtle. From unexplained fatigue and swollen ankles to changes in urination and persistent back pain, these signs are easy to miss, but they shouldn't be ignored. Your kidneys play a vital role in your overall health, and taking care of them is crucial. If you're experiencing any of these symptoms, please don't wait, talk to your doctor and get your kidneys checked out. Early detection could make all the difference. Now is the time to take action and protect your health. Don't forget to like this video, share it with someone who might need to hear this information, and subscribe for more health tips. Stay informed and take care of your kidneys.